all that said, I will now pass it off to Dr. Chuang to introduce herself and get started on her presentation.
Hi, everybody. Thank you, Shadow Buddy, for having me here today. I am a private practice breast surgeon in New Jersey, and I'm excited to be talking to you guys today. Next slide. You're going to get a quiz at the end, so try to pay attention. I don't think it's going to be that hard. Next slide. So as I said before, I am a breast surgeon. I only do breast. I treat benign and malignant pathology of the breast, and it is my focus and my specialty. My husband is also a surgeon. He is an orthopedic surgeon. For some people, it's good to marry somebody in the same field. For some people, it's bad to marry in the same field. For me, it's good that he is another surgeon, so he understands surgical technique, management of patients, but we are all in different specialties. I went in general surgery and he's in orthopedic. So we still have our uniqueness and our specialty, but we still overlap a little bit. We also both work in the operating room, so we understand how the drama is in the operating room, getting the turnover and all that. And during this whole thing, with our pandemic, I delivered a baby girl in the peak of the pandemic, and we've been bonding since then. Things that I like to do on my spare time besides working and taking time for myself. I like going to the park on the weekends with my daughter and my husband. We like to explore the local county and state parks that are free and that I've never discovered before. Usually we'll find a local bakery in the morning and get some breakfast and bring it to the park while we enjoy the outside fresh air and the playgrounds. So that's what we like to do. Next slide. So as a child, I really enjoyed my science classes and also my math classes. I like knowing why things happen. And in medicine, a lot of it is knowing why things happen, like physiology. If the pump's not working, things get clogged up. I love all this physics, math, and science. So that's why for me, going into medicine was an easy decision because I enjoy this stuff. I actually look forward to my physiology classes because I could understand why the kidney works the way the kidney does or why the intestines work the way that it does. Everything just makes sense for me. I'm more of a logical person versus an emotional person. I did not do well in my literature. Like I did well on the test, but I didn't enjoy it. Like if somebody told me to write an essay, it would be torture. But if you told me to understand why the mechanics happen or solve a math problem, I would do that in a heartbeat. I used to do extra math problems just for fun because I enjoy knowing why things work and getting the solution. I grew up from an immigrant family. I have the American story. My parents came here with, the clothes on their backs and 2 luggages, and they've established how they are in the America. But my parents always wanted us to realize how lucky we were to be born in this free world, and not everybody is born in a free world and is able to even pursue education, especially as a woman. So they wanted us to always give back and let us realize how lucky we are. So I went to a normal public school in New Jersey, nothing fancy. I took all the classes that were offered, a mixture of honors classes and AP classes. I was lucky enough to have enough AP credits that when I started college, I was already at a sophomore level, which helped me in picking classes because I could choose classes before my peers could choose classes due to my credits. I did biology and had an honors concentration while I was at Villanova. And then while I was applying for medical school, because it takes time to take your MCATs and get all your letters, I got a MPH and an MBS from Rutgers. My MPH is in biostatistics and quantitative methods. And then I went to Rutgers, New Jersey Medical School, which is the state university in my state for medical school. It is in a very underserved area, and I enjoyed every moment of my medical school. We had a great experience. We got good didactics and good clinical experiences. We had the oldest run student clinic in the whole country, whereas first and second year med students, we were treating patients, obviously under the guidance of an attending and a third and fourth year medical student to help that. So that was really amazing. In the end, we were helping patients with social work, getting medications for free. And it was a great learning experience. After that, I went across the bridge and went to Long Island, where I did my general surgery training at Nassau University Medical Center. After 5 years of general surgery training, I went back to New York City and did my fellowship in breast surgical oncology at Mount Sinai. Next slide. Some of the things that I enjoyed doing on my spare time while I was in high school and college, I did a lot of volunteering and community service. I volunteered a lot in the hospital because I wanted to know, was this a career I wanted to pursue? If it was not something, I didn't want to go down that path. I did everything from, sterile processing, where I helped clean all the instruments they use in the operating room, and also package them. I also pushed patients around in wheelchairs and helped with the transportation team. I also helped pass out magazines. So I did a lot of things in the hospital, and nothing was below me. And I thought that if I wanted to be a doctor in the future, the best doctor understands everybody who comes and works around them. And I feel like that would make a good leader. So I wanted to be able to actually put my shoes in other people's shoes, put my feet in other people's shoes. Things that I struggled in medical school was that we get so much information. We get just hours of didactics, and it's so much information that we had to learn so quickly. And that was what was a little hard for me. The information is not hard itself, but it's just packing everything in like a week and be like, oh, you have to learn all of this in 1 week. If they spread it out in over 4 weeks, it's easily doable, but it's just so much information in a short amount of time. Next slide. So after I finished medical school, I went to residency, and in order to become a board certified general surgeon in surgery, we had to pass an oral and a written exam. And we take our written exam in our 4th or 5th year of residency. And then after that, within 5 years, you have to pass an oral exam. Every specialty is different. Medicine only has written exam. Anesthesia, orthopedics, urology, OBGYN. Basically, most of the surgical specialties require an oral and a written exam to get board certification, versus a lot of the medicine specialties only have a written exam, like general medicine, pediatrics, radiology, they just have a written exam. After I passed my boards to become a board certified general surgeon, and after a couple of years of practice, I applied to be a fellow of the American College of Surgeons. It is our surgeon society, and it is the most prestigious position you could get in surgery, to be part of the fellow. So those are the FACS behind our name. So if you go to, I think, pediatrics, it's FAP, because, fellow of the American Pediatrics. So you have, every specialty has their own fellowship. My fellowship is in breast surgical oncology. So mostly I treat breast cancer, but I also treat non-cancerous disease of the breast. The extra year of training allows me to become a specialist and give more personalized and most up-to-date care to my patients. Next slide. So in my Monday through Friday, half of my week is seeing patients in the in the office, and half of my week is doing cases in the operating room. While I'm in the office, I will also do some procedures that are small, like remove small lesions or do biopsies, and that patients might need. The reason why I chose surgery is because I like the instant gratification. When somebody has appendicitis, you take out the appendix and they do well. You get to see the results. Versus if somebody has high blood pressure, they don't even feel the blood pressure. It's a number you see in the screen. You give them medication. It doesn't make it come down right away. It takes a long time to figure out which medications work well. So for people who like instant gratification, they tend to go towards surgery because you get a result right away. I found myself as a first year student in the operating room as an anesthesia student, and I love being in there. The operating room just completely got my attention. I could stay in there for hours and not be tired. And it was during my third year rotation that I realized that my love for the operating room was because I love watching the procedures and doing the procedures. During my surgery rotation, it was rough. We had to be in there before the residents. We had to change all the dressing. So I was there at 4:30 in the morning and helping out and leaving really late, 7, 8 o'clock at night. And I would be exhausted, but I would love my days. Versus when I was on psych, you come in around 9, 10, leave around 2 or 3. I was tired all day. It just didn't grab my attention. So for students, it's important to find a field that grabs your attention and that makes you want to do more. Surgery used to be a very male dominated field, but now we are having more and more women in it. So as that happens, we will have more women in leadership. Currently, there are a lot of men in surgery in positions of power. And sometimes some of the old school men try to make it upon them to show, the students who they are, and they like in making, sometimes some of the female doctors cry, and they enjoy it, unfortunately. Hopefully that will change. Next slide. So what I love about being a breast surgeon is that people who come to me have a chance of cure. So breast surgery, breast cancer is now the most common cancer worldwide, and it's a little bit due to the good screening that we have. We're able to catch breast cancer very early and able to give patients a complete cure. So patients who are probably not curable go to the medical oncologist and never see me usually, and they never go to the operating room. So I think actually being a breast cancer specialist is one of the happier fields. In the beginning, it's a little sad while you're getting the patients through the diagnosis and everything, but at the end, it's very rewarding. With every October, the whole world goes pink for Breast Cancer Awareness Month. 1 out of 8 women have breast cancer. So there are a lot of people, everybody knows somebody who's had breast cancer. And it's not something you did that made you cause it, just like smoking for lung cancer. People don't know why we're getting more breast cancers. It could be something in our food, and it could be genetics. There could be a lot of reasons. So basically, there is a lot of funding for breast cancer, and that's why the whole world is pink in October. And it's great because now we are having such innovative studies coming out, and we're doing less and less, and we're getting better results. One of the misconceptions people have about surgeons is that we do make a lot of money. Yes, doctors do tend to make a lot of money, but compared to our peers, we don't start making money until 10, 15 years after our peers do. And during that time, our peers are already making money and accumulating, able to invest. And on top of that, when we start making money, a lot of people have up to $500,000 in debt. And a lot of the times we bill for stuff and we don't get the stuff that we bill for because the insurance companies won't reimburse us for the procedures that we do. Next slide. So I had a patient who came in, she's like 60-year-old female. She was complaining about right breast swelling and redness. And I sent her for imaging and it all came back as normal. And I thought she had an infection. So I kept on treating her with antibiotics, but it never got better. There was still swelling. Even though she was African-American, I can tell that there was some redness. And I kept on telling the patient, please come back. These antibiotics aren't working. Let me switch it up again. I'm like, I don't understand why these antibiotics are not working. So I decided to do a biopsy. And I did a biopsy and it came back as breast cancer. And because she had all those skin changes, she had something called inflammatory breast cancer. And that is the most aggressive breast cancer that we have, which needs to be treated with surgery, radiation, chemotherapy, and the medication. So if I had listened to all the imaging and all the radiologists and everything else, she would have waited a whole nother year before we treated her. But because I knew something was just not right, I told the patient and her daughter that I wanted to do the biopsy, and they are so grateful that I did because I caught her breast cancer. So Inflammatory breast cancer is the most rare breast cancer and very aggressive. What the patients experience is usually a peau d'orange look, like the skin of an orange peel, due to the swelling of the breast cancer. It blocks up the lymphatics, and that's why your breast swells, and that's why you can see all the hair follicles, and that's why it looks like an orange. It is diagnosed with a physical exam, and usually you need a punch biopsy of the skin to look at dermal lymphatic invasion. A punch biopsy is a circular blade that I use to cut the skin of the breast. So just some advice that I can give you guys. You guys are all high school students. You don't have to know exactly what you want. Nobody always knows exactly what you want, but you should have an idea like, oh, let me try this. Let me try this. You should rule things out and rule things out in as well, to say like, hey, this I didn't like anymore, so I don't want to do this anymore. But this, hey, I actually like this. Let me pursue it more. Just have an open mind. Don't freak out if you don't know exactly what you want to do. A lot of my med school classmates didn't have the typical bio major. In fact, most of my friends were not bio majors. I have a friend who is an Arabic major, a lot of engineering people, political science, art history. Huge. I had people who were professional musicians before they came to medical school. We actually like accepting people who do not have the typical bio major. So college is a time to get to know yourself and get to know what you like and what you don't like. So try to go explore that. Make sure you don't become a doctor just because you want the money and the prestige, because it is not worth it. All the hours and, loss of sleep and like loss of time spent with your family, it is not worth it. If you really want to make money, go into finance, go into banking. You will make a ton of money, but don't go into medicine because you want money, because you will be miserable and you will be, and you won't be able to survive. It's not worth it. And make sure you start volunteering early on. Make sure you actually want to do this. Make sure you want to go into medicine before you dedicate the next 15 years of your life into something. So just kind of try it out first before you commit. Next slide. Any questions?
Okay, so ooh, I'm sorry about that. Okay, so now we will have our Q&A session, and if anyone would like to unmute or type in chat their questions, then feel free to do so. Oh, there's been one question from Katarina in chat. She asks, what is specifically difficult about breast surgery in comparison to other types of surgery?
Breast surgery, I don't think is that hard to do, honestly. But it is hard to make it look nice. You can always cut it out, but to do something like I do, it's called oncoplastics, where you try to hide incision and make it look nice, because most women with breast cancer who undergo surgery will live a long time. I don't want them to look at their body every day and feel disfigured or, mutilized by the surgeon. I want them to look just as good as they did before, because the emotional part of the breast cancer is very real.
I actually have a question for you myself. So I was wondering if there was like a mentally challenging part to your job, and if so, like what is the most mentally challenging part?
So I am in my 30s, and most breast cancers are diagnosed after 50. And recently I've had a bunch of women who are younger than me that I'm managing with breast cancer. So that has been actually very difficult for me. And when we have patients who are younger with breast cancer, we always worry about fertility and if they want children in the future, because when young women get breast cancer, they have a higher chance of needing chemotherapy. Chemotherapy puts 50% of people into early menopause. So with that, it's very likely that, after chemotherapy, and all the medications, their age is so old that it's going to be more difficult to have the children, or that the chemotherapy puts them in menopause and then they don't have eggs. So we have to do a lot more of emotional support. So I just recently had a huge, like a bundle of young breast cancers, and they've been just draining me emotionally as well. And sometimes it's hard for me to separate my work from my house, but I need to be better with that.
We'll give the questions a couple more minutes, and afterwards we can move on. Okay, so Grace asked, how do you think your work has impacted your patients?
I think my work has strongly impacted my patients. They are very happy with their results and the support that I give them through their breast cancer journey and treatment.
Okay, so this will be our last question. Someone asked, when did you make the decision to go into medical and then into breast surgery?
So I made my decision to go into medicine after I did a bunch of shadowing just to make sure. I did years of shadowing just to make sure I really wanted to do it. And I didn't really like anything else. I didn't want to do accounting or business. I don't know, money doesn't really interest me, like watching the stock market. I just cannot find it interesting. It does for some people, but not for me. I decided to go into breast surgery. Maybe my third year probably of general surgery residency. My program has an underserved air clinic that we do breast cancer screening for people in Nassau County. And after that, we manage them. So we have it every Tuesday. And I like the continuity and the multidisciplinary aspect of breast surgery. And that's why I decided to apply for a breast surgical oncology fellowship.
Okay, so we'll move on now. Um, so that was it for Dr. Chuang's presentation. I'd like to thank the audience so much for coming, and a special thanks to Dr. Chuang for giving a wonderful presentation to us all. This is just a very quick reminder that after this webinar, we encourage you to use the notes you've taken and what you've learned throughout this presentation to take our quiz. I'll actually give the quiz link in chat right now. I know that 70% might sound difficult, but I promise you that the quiz is very low stress, and as long as you're paying attention, then it should all go fine. This meeting will also be recorded, and it'll be posted to our YouTube, and in the description of the video, we'll also include the link. If you'd like to reach out to us, you can do so through our email and through our Instagram. You can also look into our website at shadowbunny.org to look out for upcoming events and sign up for our newsletter, which will remind you of those upcoming events. We also encourage you to join our Discord server. I'll link all of these socials in the chat as well right now. Finally, I'd like to all to encourage your friends to join our future shadowing sessions, and we hope to see you at the next one as well. Thank you all so much for coming, and we hope you have a wonderful night. I'll stop the recording.